guys, this is Dr. Hub. Today we are going to look at the dissociative disorders. So under dissociative disorders, we are focusing on the TS5 classification of the disorders. So to begin with, we are going to look at the dissociative amnesia. So to begin with, we are going to discuss the dissociative amnesia. So dissociative amnesia is nothing but the failure to remember important information about oneself. So it is failure to remember. The failure to remember important information. Failure to remember important information. And this is about oneself after a stressful event. About oneself after a stressful event. After a stressful event. So what are the characteristic features of the dissociative amnesia? So this includes that the amnesia it resolves in minutes. So the amnesia it resolves in minutes or days, or it can even last for years. So other thing to note is that the retrograde amnesia is greater than the anterograde amnesia. Next we move on to the dissociative fugue. So under the dissociative fugue, the amnesia is combined with a sudden wandering. So there is sudden wandering from home after a stressful event. From home after a stressful event. So this is dissociative fugue. And here the feature is that there is the adoption of different identity. So there is adoption of the different identity. The patient denies memory loss during the fused state. So the patient denies memory loss during the fused state. Next, we are going to look at the dissociative identity disorder. So the dissociative identity disorder. So here, this is nothing but a previously called multiple personality disorder. So multiple personality disorder, and at least two distinct personalities is an individual. So at least two different personalities are seen. So what are some characteristics of this multiple personality disorder? So this includes, there is more common in case of women. So women it is more common, and particularly those who are sexually abused in childhood. So they are at high risk. Sexually abused in childhood. So in case of a forensic setting, and also in case of forensic setting, that is in case of jail. And malingering and alcohol abuse, in case of malingering and the alcohol abuse, it must be considered and excluded. So all this can be considered. Next, we will move on to the depersonalization disorder. Depersonalization disorder. So depersonalization disorder, it is nothing but a recurrent, persistent feeling of detachment from one's own body. So you feel detachment from one's own body. And there is the social situation or the environment when stressed. Or the social situation or the environment. This is when stressed. So what are some features of this depersonalization disorder? That there is an understanding that these perceptions are only feelings. So there is a understanding that these feelings, that these perceptions are only feelings, that these perceptions are only the feelings. That is the normal reality testing. That is a normal reality testing. Next, we move on to the dissociative disorder not otherwise specified. So, dissociative disorders which is not otherwise specified. So, this includes the dissociative symptom such as the trance-like state. So, there is trance-like state as well as there is memory loss. So, what are the some features of this? There are persons exposed to intense coercive persuasion. So, there are persons exposed to the intense coercive persuasion. So, this is nothing but brainwashing. Next, it also includes the indigenous. It is indigenous to particular location. So, to particular locations as well as the cultures. So, what does it include? It includes such as amok in the Indonesia. So, then we'll also highlight a bit of the ICD-11 of the classification, and this is in case of the dissociative disorders. In case of the dissociative disorders. So, what does this include? This includes there is a dissociative identity disorder. Next, there is a partial. There is a partial dissociative identity disorder. Next comes the depersonalization. Depersonalization or the derealization. Depersonalization or the derealization disorder. Next comes the dissociative amnesia. Dissociative amnesia. Then there is a trance disorder. There is a trance disorder. There is a possession trance disorder. Possession trance disorder. Then there is also the dissociative neurological symptom disorder. There is a dissociative neurological symptom, dissociative neurological symptom disorder, and also the secondary dissociative syndrome. The secondary dissociative syndrome. So, this was about the dissociative disorders. We saw the classification in terms of the DSM-5 as well as the ICD-11, and we have highlighted few characteristic features of the DSM-5 classification. So, to grow and learn daily like this, please do subscribe.